Okay, clinical assessment. Once
Okay.
again. So, may I ask you what your name is?
Deborah.
Nice to meet you, Deborah.
Nice to meet you.
I have not taken class with you for the past couple of months at all.
Yeah, totally not.
Okay, can you tell me what your symptoms are?
So I'm having a lot of pain in my ankle, especially when I move it around or when I walk.
Mhm.
Yeah, and it's swollen and red, and it's
And nothing else is wrong with it? Just
No.
Okay. And there's nothing else wrong with you
No.
other than that? Okay, great. Can you tell me if you have any allergies?
No.
Any medications? Do you take any
Mm-mm.
prescribed medications? Have you taken any Advil, any illicit drugs, or regular vitamins?
Well, not today. Not in the
Okay,
past
not in the last
24 hours.
48 hours?
Or 48 hours. Yeah.
Okay, excellent. Okay. What's your past medical history? Have you ever hurt this ankle before?
No. I know some injuries similar to this.
Okay. And you don't have any conditions like diabetes or something like that?
Mm-mm.
Okay. When was the last time you ate and drank?
I had some gummy bears about like half an hour ago.
Okay. And the last time you drank?
This morning.
And what were the events leading up to this incident? To your injury?
So I was running and I sort of twisted my ankle inwards, and that's when the pain started.
So inwards?
Yeah.
So have you noticed that it's swelling, right? You told me
Yeah,
it's
swelling.
And redness?
Redness, yeah.
Okay. Have you noticed it's been like hotter than your other
Yeah,
ankle?
it is a bit warmer.
And you can't move it as well, right?
Mm-mm.
And you're in pain, yes. You mentioned that. Do that in order. Okay, I'm going to ask you a couple questions about your pain now.
Okay.
So when did it start?
Well, it started as soon as I twisted my ankle.
Can you tell me what the quality of your pain is like?
I would describe it as a sharp pain.
Is there anything that provokes it and makes it worse?
I guess just like moving it in certain ways, especially like
Inwards?
inwards. Yeah.
Does it radiate at all?
No.
And what would you say the severity is? 10 being on a scale of 1 to 10, 10 being you cannot move from the pain, and 0 being there is no pain at all, and 5 being kind of in between, like the pain is noticeable and bothersome, but not debilitating.
I would say 7.
Okay. Does it get better over time?
No, I would say it's stayed pretty much the same.
Is there anything that alleviates pain?
Just like icing it, I guess. Not moving it, just keeping it like stable, no movement. Yeah.
Awesome. And then I'm just going to look at it for a bit. So could you swing your legs back up? Okay. So I'm looking for any obvious deformity, which I see none. Any redness, I've already been told that there is redness, and I can observe that here now. Any swelling, I do see swelling. Any altered function, and obviously she can't walk very well. Any obvious signs of pain? How many was that? So altered function, swelling, obvious signs of pain, deformity. Redness, swelling. Oh yeah, and skin changes. So do I see any wounds or rashes? Almost forgot that one. So I have noted down the swelling, the redness, the obvious signs of pain. Nothing else significant. So I will move on to ranges of motion, which will our furniture go first. Okay, so there are 4 ranges of motion in the ankle: dorsiflexion, plantarflexion, inversion, and eversion. So first, I'm going to do active range of motion on both feet, so I can do a little comparison. So, The shoes might get in the way, so I'm gonna take the other one off. I find that athletes don't like taking both of their shoes off, so I try not to do it every time, but. Okay. So this is your bad ankle, this is your good ankle, yes?
Yeah.
Okay. Could I have you bring both of your toes to my hands? So both full, do you have any, there's no pain here?
No pain.
And
There's a
pain?
lot of pain.
Okay, so on that scale of 1 to 10, how much worse does it get?
I would say it's an 8.
8? Okay.
Yeah.
And then bring your feet to my palms.
That
So-
really hurts, yeah.
And out of the scale of 1 to 10?
I would say an 8 as well.
Okay.
Yeah.
So what we're seeing is dorsiflexion is full with an 8 out of 10 is slightly reduced pain. For plantar flexion, her range of motion is slightly limited. 8 out of 10 again?
Mhm.
With an 8 out of 10. Alright, so just bring it up to a slightly neutral position right there. And turn your foot outwards towards my hand. And no
Oh.
pain?
Yeah. No pain.
No pain. And then same on the other side.
There is a little bit of pain, but
Just slight increase. Would you say it's as much as the others or
I would say it's a little decrease.
decrease in pain?
Yeah.
Oh, interesting. Alright, and on that scale of 1 to 10, what would you say it is then?
I would say a 7.
A 7? Okay. And then inversion. Did you bring your feet? Yeah.
Yeah.
You got it.
Yeah.
And no pain.
No pain.
And then over here.
Yeah, a lot of pain.
Limited, and what would you say that is out of 10?
8 out of 10. Mm-hmm.
Okay. So 8 out of 10. Alright. So that's active range of motion. I'm going to do passive range of motion. First on the good side, so I have a good reference point. So I'm just going to move your feet. Don't use any muscles whatsoever.
Okay.
Dorsiflexion. Plantar flexion. Back to a neutral position. Inversion. And eversion. All good? I'm going to do it on your other side.
Okay.
Tell me when it starts to become painful. Dorsiflexion.
That's painful. Yeah.
And out of 10?
8.
8 out of 10? Okay.
Yeah.
And then plantar flexion.
Yeah, that hurts. 8 out of 10. Yeah.
And then back to a neutral position. Eversion.
I would say 7.
7.
7 out of 10.
And then inversion.
Yeah, 8 out of 10. Yeah, really hurts.
So PROM and AROM presented the same for pain levels, not limiting for PROM at all though. And we are going to do strength tests now. So could you just bring your feet up a little and hold against my hands?
Like, pull, like,
Yeah, yeah, I'll do it this way. Push against my hand.
oh, okay.
Now I'll do it on the other ankle. Push against my hand. So barely any resistance, 3 out of 5. Then push against my hand. Push against my hand. A little bit more resistance, I'd say about 4 out of 5. Then push against my hand. Push against my hand. So only a slight amount of resistance, 2 out of 5. And then push against my hand. Push against my hand. Practically no resistance, 1 out of 5. So that's the strength and endurance testing. We're moving on to palpations now. So looking for point tenderness. Tell me when it hurts.
It hurts there.
There, right there.
Yeah.
So a bit of pain above the malleolus. And when does it stop?
Stops there.
Right there?
Yeah.
Okay. And anywhere else?
No.
For this injury, I won't hear any cryptus, there won't be any instability, or deformity, whatever you want to call it. I obviously feel a bit of swelling, so deformity, swelling, point tenderness. I'm looking for a distal pulse, which we will just do capillary refill because most of our athletes are pretty young, and I still don't know where to find the pedal pulse. Okay, so we can just do it there, or we can do it on, nails always easier, but sometimes it's more useful to just do it on the skin. Okay, so pulse in place, distal pulse. Temperature. Yeah, skin temperature feels like about the same on each side. Good to compare because some people might have cold feet. So temperature. So it was temperature, distal pulse, crepitus, skin changes was one of them, I think. I don't notice anything besides the swelling that has changed. Crepitus and stability.
Is that all? Yeah.
I think so. Okay. All right. I'm done myself now. In any case, I don't know anything important besides the point tenderness and the swelling. So now that I'm done my palpations, I can do an index of suspicion. So the pain would probably tell me something along the lines of a, well, first it's going to be a sprain because of the equality with both of the AROM and the PROM. They were the same pain, the same pretty much everything. So we're gonna go with a sprain, and I'd say because of the lack of strength and the lack of strength and the pain levels, we're going to say it is most likely a second degree sprain of the ankle, obviously. Is that it? Is there anything else we have to do with that?
No, I think